This evening, before we start our meditation, I'd like to speak about the importance of stress management. And in this difficult time of coronavirus that the whole world is facing. I'll be speaking in English, in Burmese, and in Shan, in 3 languages. This is an unprecedented time for the whole world, that we are facing something frightening. We have faced, the world has faced a lot of epidemic, and what we can also call, pandemic in the last centuries, and also some in this century. We have SARS and MERS and that kind of diseases in the last 20 years. Now we have this. It is a time of heightened anxiety and worry for every government, for every citizen in every country, rich or poor, educated or non-educated, everyone, every country, developing, underdeveloped. Every country is facing an anxious time that may seem to go on, lasting for some time. As we all know, things are changing very quickly. I want to read you the message I got from my GP, my general practitioner, my doctors. So there are local surgeries. We have to go to them first, and if they think we need to be referred to the hospital, then they would refer us to the hospital. We can't go to the hospital straight away. This is a system. So within the last 10 days, I have been receiving no less than 5 messages. And one of them talks about the decision to suspend, to stop all the bookings of routine appointments. I want to read you this one. This is on Tuesday, last Tuesday, about 6 days ago. Due to the increased pressure caused by the coronavirus outbreak, we have taken the decision to suspend the booking of all routine GP appointments. If you need to consult with a clinician, please telephone the surgery. Advise the receptionist what your concerns and needs are, and the clinician will be with you and if a telephone appointment is appropriate, they will call you back and assess your needs. In many cases, they will be able to deal with your concern without the need for you to come in to the surgery, so without going into the clinic. They want to give you consultation through telephone. If they feel that you need to be seen, They will offer you a suitable appointment. Please bear with us over the coming days and weeks as we manage this situation. Bear with us means to be patient with them. Things are changing rapidly, and we will continue to provide the best service that we can while doing our utmost to protect our patients and staff. You can see that they have a lot of doctors and nurses, but still they are under enormous pressure. I'm talking about one of the surgery, GP surgery, they call surgery. Here in this country, in Myanmar, we may call this clinics, where I'm registered. And and they inform us that they are under enormous pressure, that they cannot give us the routine appointment as they used to. You can read the news. I update myself, with two websites, the BBC website and the CNN website. The CNN to get news from America, the BBC to get news from the United States. And Myanmar Ministry of Health website. Things are changing all the time. The whole Italy, the whole country is in lockdown, meaning people are not allowed to leave home. Yeah, the same with a few other countries in Europe. And the countries that have not introduced a lockdown, they're actively considering it. In the United Kingdom, they start from the people over 70s. And it's not 2 weeks. Okay, it's 12 weeks. Asking them to stay at home. Of course, in many countries, including America, schools and universities have been closed. The biggest state in America, California, is in lockdown, and they enforce the rules very strictly. The reason is that because the virus that we're facing now, the Covid-19, this coronavirus, those viruses, they also come from animals, they infect human beings. But they stop there. They don't infect, they don't spread from human to human. But this one is spreading from human to human because it has been mutated. It has transformed. And human body, our body, human body does not know this virus yet. So it doesn't know how to deal with this. It doesn't know how to deal with this yet. Over time, yes, human immunity will know. But before we reach that point, a lot of lives will be lost. And WHO has looked at the past history of the world facing, this kind of pandemic. Because when it happened, no one really knew about this kind of pandemic, this kind of virus, and people will have start working on the remedy, on medicine. Just before coming to this Dhamma talk, I read a piece of news from Oxford that Oxford University is trying to test this virus as quickly as possible in 30 minutes. They're developing this. So a lot of top universities and government, they are working round the clock to find an answer to this. At the moment, no one knows for sure. People, some scientists, they know a certain aspect, but they don't know the whole thing yet. And we rely on them. We rely on them. So, despite the proud achievements that we as a human being can boast, like going to the moon, developing a lot of biochemical related things like biochemical revolution, in addition to agricultural revolution. We are not able to bring this under control with any remedy yet, with any clinical execution yet, clinical implementation yet. So the scientists, the medical scientists, and also the doctors, they advise us to practice social distancing. In some country, they allow up to 50 people, 50. In some country, only 10 people. In some country, 15 people. Now, today, Germany has declared only 2 people can gather, because the rate of spread is very fast. So at this time, in every country, for people who, say for example, for Myanmar people in Myanmar, or maybe who are working elsewhere, maybe in Thailand, in Singapore, in Malaysia, in Europe, in Korea, in Japan. People will have a lot of anxiety. A lot of anxiety. Life is severely disrupted. And this is the compromise that we have to do. This is the price that we have to give if we want to survive. If we want to survive. In 1918, when the world faced this kind of pandemic, in America, people from, I'm told that people from Philadelphia and Baltimore, and they didn't give attention, and they didn't heed the advice of the healthcare professionals and the government. So they went on socializing as usual. So those two areas, they were the hardest hit in the United States. We can say that, okay, it could have been prevented with simple solution, by staying at home, by taking care of themselves. Here, I don't want to talk about the medical side, the clinical side, because I'm not qualified to do that. I'm just reminding you that the way I remind myself daily that this is a serious business. But when we say this, it's very easy for us to panic, to develop a lot of fear. When we are in fear, we are very stressed out. There is continuous stress dominating our mind. If that happens, it's very easy to get angry with each other. It's very easy